Hello, this is Taekyung Kim. Today I'd like to talk about Lyme disease and the gut tract inflammation, such as gastritis, enteritis, diverticulitis, colitis, inflammatory bowel disease, and irritable bowel syndrome. Lyme disease is a bacterial infection by Borrelia. It can be best treated in the early stages. Treatment for early localized disease is a simple 10 to 14-day course of oral antibiotics to eliminate the infection. It normally takes 28 days to 3 months to get rid of the infection. If people are treated for Lyme disease with antibiotics but continue to experience symptoms, it is referred to as Post Lyme Disease Syndrome or post-treatment Lyme disease syndrome. About 10 to 20% of the people with Lyme disease experience this syndrome, but doctors and scientists still do not know clearly why. I can see that most of the people who have post-Lyme disease syndrome have a high level of inflammation on their lining of gut tract, and the gastritis, enteritis, diverticulitis, colitis, inflammatory bowel disease, irritable bowel syndrome are the most common medical conditions of people who have post-Lyme disease syndrome. Gastritis is an inflammation of the stomach lining. The lining of the stomach often looks red, irritated, and swollen, and it may have raw areas that can bleed. Frequently, gastritis comes with constipation, diarrhea, or severe cramping pain. Enteritis is an inflammation on the lining of the small intestine. Symptoms of enteritis are diarrhea, nausea, loss of appetite, severe cramping pain. Diverticulitis is an infection or inflammation of the pouches that can form in your intestines. These pouches are called diverticula. The pouches generally are not harmful. They can show up anywhere in your intestines. If you have them, it is called diverticulosis. If they become infected or inflamed, you have diverticulitis. Sometimes diverticulitis is minor, but it can also be severe with a massive infection or bowel perforation, which is a hole in the small intestine or large intestine. Symptoms of diverticulitis are nausea, vomiting, constipation, diarrhea, abdominal pain or cramping pain, etc. Colitis refers to an inflammation of the inner lining of the colon. There are numerous causes of colitis, including infection from virus, bacteria, or parasite, insufficient blood supply, allergic reaction, etc. Symptoms of colitis are diarrhea, fatigue, dehydration, skin inflammation, swelling in the joint, abdominal pain, cramping pain, etc. Inflammatory bowel disease is a term mainly used to describe two conditions, which are ulcerative colitis and Crohn's disease. Ulcerative colitis and Crohn's disease are long-term conditions that involve inflammation of the gut. Ulcerative colitis only affects the large intestine, but Crohn's disease can affect any part of the digestive system, from the mouth to the bottom. Symptoms of these two conditions are diarrhea, weight loss, fatigue, abdominal pain, or cramping pain, etc. It is unclear what causes inflammatory bowel disease, but is thought to be caused by a combination of two factors. The first factor is genetics. People are more likely to get inflammatory bowel disease if they have a close relative or parents with the conditions. And the second factor is a faulty immune system. It can also be called an autoimmune disease. It has been known that people who smoke are twice as likely to get Crohn's disease than non-smokers. Irritable bowel syndrome is a common long-term condition of the digestive system. Symptoms can include stomach cramps, bloating, diarrhea or constipation, etc. One of the most common symptoms of these gastrointestinal tract problems is an abdominal pain or cramping pain on their low abdomen. Sometimes people go to A&E because their pain is incredibly severe. In case of ladies, the pain can be aggravated before or during the period. People who have post Lyme disease syndrome cannot absorb enough nutrition from what they eat because of the gut tract inflammation. When people suffer from gastrointestinal tract inflammation for a long time, then their blood level keep going down due to the long-term lack of nutritional supply. And at last, they easily get to the anemic condition. Many doctors and complementary medicine practitioners seem to believe that this high level of inflammation on the lining of the gut tract of people who have post Lyme disease syndrome is caused by the bacteria Borrelia. So they try hard to kill the bacteria Borrelia by using many different types of antibiotics. Therefore, some Lyme disease sufferers are required to take various strong antibiotics over several years. Previously, it was thought that the antibiotics only killed the gut bacteria and blocked some immune functions in the gut. But the new study shows that they also can destroy cells in the intestinal epithelium. In other words, antibiotics can cause some damage on the lining of our gastrointestinal tract. On top of this, doctors normally use strong steroids to treat this high level of gut tract inflammation. A steroid is a very strong anti-inflammatory medication, but when it is used for a long time, it also can cause severe side effects such as cataracts and glaucoma, immunosuppression, muscle wasting, bone changes, fluid shifts, personality changes, high blood pressure, an increased appetite leading to weight gain, irregular menstruation, and an increased growth of body hair, skin discoloration, etc. As a practitioner, I believe that this gut tract inflammation of people who have post Lyme disease syndrome can be caused by the shock of the bacterial infection, not by the bacteria itself. In other words, our immune system has a big shock and highly confused by the bacterial infection, and it becomes hypersensitive. This hypersensitive immune system starts to overreact excessively, and it causes a high level of inflammation anywhere in our body. In case of people who have a sensitive gut, the damage of the lining of the gut tract inflammation seems to be much bigger than people who do not have a sensitive gut. Normally, people who have a sensitive gut tend to have a low threshold for the stress or shock, and they are physically, emotionally, and mentally very fragile. Simply speaking, their lining of the gut tract is easily, quickly, and highly inflamed, even by the low level of stress or shock, comparing to other people who do not have a sensitive gut. Therefore, people who have a sensitive gut might have much bigger damage on their body systems by the Lyme disease, and the suffering period can be much longer than the people who do not have a sensitive gut. To cut down this high level of inflammation, first of all, people should follow the specific group of diet for their own body type. We 8 constitutional therapy practitioners divide all the human beings into 8 different body types according to their own individually distinctive internal organs dynamics. The right diet for the right body type can make all our internal organs well balanced. These well balanced internal organs can work their best, and these optimized internal organs can maximize our healing ability. Second of all, people should eat each meal on time and the same amount every day. This can make our stomach stronger and stronger as time goes by. When our stomach gets stronger, we can absorb more nutrition from what we eat. This can make our body system work better energetically. As a result, our healing process also can be accelerated. Third of all, people need to have a regular treatment session. I believe that 8 constitutional acupuncture can be one of the safest and best treatment methods. Many people who have post Lyme disease syndrome are required to take an intensive steroid treatment for their gut tract inflammation. But this intensive steroid treatment can even cause more troubles. Last of all, people need to learn how to manage their daily stress or long-term ongoing stressful issues. Quite often, I can see that many people have been having specific stressful issues for a long time, sometimes more than 10 years or even longer. They believe that all those issues have been cleared completely, but actually those stressful issues might have been hidden deep in their mind. In this case, they have to work hard together with practitioners to deal with those long-lasting stressful issues. When people follow these 4 procedures strictly, then as session goes by, their tummy discomfort will be less and less. When people have less inflammation on their inner lining of the gut tract, they can have a better digestion and absorb more nutrition from what they eat. This will accelerate their healing speed. Thanks for watching this video.